Good evening, everybody, and thank you for joining us. I'm Peter Rutherford, the Rural Doctors Association of Australia, CEO, and thank you for coming and joining us tonight. This is our second webinar regarding telehealth. I'll just quickly introduce or hand over to Dr. John Hall. I don't think his camera's working, but that's the reality of working in rural and remote Australia, and John's working out at Walgett at the moment. So, John, I'll just check that you can hear me.
Yeah, I've got you loud and clear. Can you hear me?
We can hear you very well. So I'll just hand over to you, John, if you could do the welcome to country and introduce our panel members and set the scene a little bit for our webinar. But again, thank you for joining us. And John, I'll hand over to you.
Well, welcome everybody. It's great to be here. And look, I think this is such an important topic. It's really, I guess, going to be transformative using telehealth going forward in our industry. I think it's one of the benefits of COVID-19 has been it's accelerated our digital transformation in the industry, which I think is welcome, and certainly for rural and remote Australians who suffer from poorer health outcomes and also lack of access to services. I think we have this opportunity for particularly video-based telehealth to really, improve access to services and improve outcomes for our communities, including remote Australia and remote Indigenous communities as well. So it's certainly exciting times to be involved in healthcare, particularly digital healthcare. I'd like to acknowledge the traditional owners of the lands on which we meet today and which we meet across a diverse geographic footprint today around the country, elders past, present and emerging. And I'd like to acknowledge any Indigenous participants in the meeting today as well. So starting off, I'm just having a look here. So we've got Nicola Graham from the Australian Digital Health Agency, and we've got Helen Storer, who's a practice manager from Western Australia. We've got Trent Gifford, who's representing the Medical Technology Association of Australia. Brianna Mewood from the Australian Digital Health Agency will help us out in the background with some Q&A. Obviously, you've heard from Peter Rutherford, who's our illustrious leader in Canberra, the CEO of the Rural Doctors Association of Australia. So that's our panel for this evening. So welcome everybody, and thank you for taking your time out to join us. In our first webinar, we covered off some of the basics around telehealth. In this webinar, we're going to get to some of the tools available through the Digital Health Agency and other technologies that are available on the market. Currently, we know that 97% of GP to patient telehealth is done by phone. As I mentioned in my intro, I think, and the Rural Doctors Association position has been clear on this in our feedback to government, that video-based telehealth is of significantly higher quality and gives us much more clinical information to be able to manage our patients. And I think plays a role certainly in being a far better replacement for face-to-face. Obviously, we all see face-to-face as the gold standard, and there's many clinical, scenarios where face-to-face is essential. But I think it's particularly important for people who have difficulty in accessing care geographically, that they have better access to video-based telehealth. There's many peak bodies in the industry that don't actually share our view on this. We're a bit of a lone voice in pushing the video-based telehealth, and I think really it reflects that it is of probably greater value for rural and remote communities where some of our patients have genuine difficulty in accessing face-to-face consults. So that's just a bit of an aside there. With that, I'll hand over to Nicola, and she's going to go through a presentation for you from the Digital Health Agency.
Thank you so much for that introduction, Thank you. And so we'll jump in now, and we'll definitely be starting to talk about the digital health tools, as John mentioned, that we spoke about last time. Now, we know that through the pandemic, practices and obviously your patients really had to get used to a brand new normal, one that included telehealth instead of that traditional face-to-face consult. So it was so new for everyone, for those ones who had never really taken heart to the telehealth. So today, or tonight, actually, we'll go through some digital tools that can help make your practice, accessing with your practice information for your patients a little bit easier for your day-to-day practice. So we know most practices in Australia actually do use telehealth in some form for their consultations, and they have done so more since the start of the COVID-19 pandemic. So what we do know is that people living in rural and remote areas really need to travel quite a distance to be able to see their healthcare provider, and this is nothing new to anyone on the line. But now with telehealth being more widely used, it really supports patients to gain access to that vital medical services that really previously that would have been very difficult for them to manage. So having access to health information about your patient at the time of that telehealth consult will also help you in your clinical decision making, and also help make the most of that time that you have with your patients during your consult, your telehealth consult.
Sorry, Nikki. I'll just quickly jump in and just let you know we aren't seeing the slides if you shared them.
Oh, okay. Let me see what's going on. Can you see it now?
Yes, there we go. All good to go. Sorry to interrupt.
Thank you so much. Yes, I don't know what actually happened there. All right, thanks, Bree. All right, so then to support your telehealth consultations, I just said, how do we make it easier for you? And one of those tools that you can use is My Health Record. But what is My Health Record? So My Health Record is actually I can hear myself talking, is a summary of an individual's key health information. And it's part of a national system. So what that means is the person's My Health Record can travel with them, and that means it doesn't matter what health or what registered healthcare provider they see, they will have access to that key health information. So it's not siloed now within just one single practice, and it does make it much easier for especially after hours or early morning. There is no requirement then to worry about a practice being open to get that information. So it is because it's a national system, and it travels with that patient. And so it also means it's accessible at all times, which is 24/7. Now, a key element of the My Health Record is that it's personally controlled. And what that means is that a patient has a say as to whether they even have a My Health Record. They can also have a say as to what's actually put in the record, and also who can access it. Now, the records are also very private, and they are protected via legislation. And now primarily that's the My Health Record Act. And it is also secure through multiple levels of international best practice in IT security. And our Cybersecurity Centre monitors, maintains, and improves that system 24/7. So as you can see in a telehealth consultation, it wouldn't matter when that was, My Health Record would certainly be there to support you. So this slide shows you the list of available documents. So having access to these sort of documents can support you not only in a face-to-face consultation, but through your telehealth. So on the right-hand side, you can see the provider documents that it's available. So that's your shared health summary that's uploaded by the provider. We can see discharge summaries. We can see pathology reports, and we can also see dispense and prescription records as well. Then consumers can also upload information to their record, and that's in the shape of a personal health summary. And they can also do advanced care planning documents and custodian details. And importantly, they can update their emergency contacts as well. And then finally, the Medicare documents. So that's something we'll look at a bit further later on. And I guess that the main one here that we can see now with COVID vaccines is the Australian Immunization Register. So that's actually available in Medicare, and you'll be able to see that information. Now in the centre, you can see there's some quick views, and I will briefly touch on those. So the medicines information and Medicare overview, which gives you quick access, and pathology and diagnostic imaging reports overviews. So the first one is the medicines information overview. Now this view, what it does is it actually collates all the information from a range of documents that you can see on the left-hand side, so the medicines that's found in, and it puts it all into this one streamlined view. And what that does is it gives you easy access to allergies and adverse reactions. So it'll collate all those allergies and adverse reactions into one view. And it'll also provide you access to the most recent shared health summary and the most recent discharge summary if it's available. Now, on that top part here, you'll see it says no discharge summary found. So if there is none, you'll be able to very quickly see that there's nothing available. But if there is, it looks very similar to this where it says the shared health summary is the most recent. And it'll also say here how long ago that was uploaded. Now, any hyperlinks within that list of documents, it will take you through to that original document. So if you're looking to see a little bit more about Avastin or Troponin here, sorry, the Spiriva, then you could click on the link in this document here and it will take you through and give you a lot more detail about it. Now, we've got with us Helen, who is that practice manager and a nurse and in a GP practice in Western Australia. Helen, would you be able to share with the audience what information do you share to the patient's My Health record, and also what information do you find in a My Health record that you have just found invaluable?
Okay, I guess we found it useful when patients have been to, you know, the big teaching hospitals in the last couple of days, and they have a discharge summary uploaded, so we then can see medication changes. We've got quite a large cohort of elderly patients, with 54% of our patient load with chronic disease. So they're, you know, quite often on, you know, 8-10 medications. They go to hospital, they get changed. It's really, you know, good if we're following up to see what changes have been made on that discharge summary. We find it useful to upload, because we've got that elderly cohort. We have quite a lot of grey nomads that head north for the winter, and it's reassuring for them to go with a summary already uploaded, easily accessible with other providers if they should need some assistance while they're away. Yeah, that's sort of, we find that really useful that way. And the same for the patients that are doing a C change or a tree change. Rather than do an awkward transfer of their medical records, we try to get them in one more time before they head off, and then upload all the information that would be useful for their continuing care elsewhere.
That's fantastic. Thank you so much, Helen. And it really does demonstrate how access to those discharge summaries really does provide a lot of information. Then you're able to upload your own, update your own systems as well. And then not only do that, but then share that information. So thank you so much for sharing that information with us. So the next one I'd like to talk to you about just very briefly is the Medicare documents. Now in here, you can see the prescription information. So that's here on the left-hand side. It also has immunization information, organ donor, and the Medicare Services. But just highlighting the Australian Immunisation Register. So here is where you're going to be able to find those COVID vaccines. And so if the patient said that they've not had one and you wanted to confirm, then you can access that. So that's in the Medicare overview in your patient's My Health record. And obviously within your clinical information system, it's a simple click to get into that area. And another key area within the Medicare documents is the Medicare Services. So here you can see, so if you have a patient like Helen just mentioned who is traveling around and they are a bit confused about their information, they don't have a great deal of detail on here, you would actually be able to access the Medicare Services and find out what GP or what health services they've been to see, along with any healthcare healthcare plans that they may have had. So that's really important to see as well. So here we have the prescription and dispense information, and I mentioned that before, and I will show you how this information is uploaded, and that's through electronic transfer of prescriptions. But what it does here is it shows any prescribed medications. So when you're using electronic transfer of prescriptions, it actually sends a copy of that prescription information through to the My Health record. Now, if that's a prescription that's over the counter, but but because sometimes patients don't remember what you want them to have, you might actually do a prescription. And if you clinically code it and it actually puts the information on the prescription, it will also send that in here. So that's a really important note, something for you to note. So if you've got even Nurofen and you write a prescription for it using the correct codes within there and sending it, it will actually show up under prescribed information in this prescription and dispense view. Now let's talk about the pathology reports overview. Now, like the medicines view, this overview collates multiple reports and allows you to see them all in this one overview. And again, any hyperlinks within this list will take you through to the original source document. So having access to pathology and prescription and dispense records certainly has benefits, but not only for clinicians, but also for your patients. So do your practices contribute pathology and prescription and dispense information? So what we'll do now is we'll just go through quickly how you actually can contribute to your patient's My Health record. So after having a look at all this information and seeing how valuable it is to be able to access that, it's also really important to be able to share it. As Helen mentioned before, sharing that information so that it can be accessed by other healthcare providers. So the first is pathology. Now, on our website, you'll be able to find information on those diagnostic imaging and pathology providers who are actually uploading to the My Health record system. And then pathology reports can be uploaded to My Health record by pathology providers. However, some pathology providers have specific requirements for this to be enabled as an automated process. Now, there are also providers with no specific requirements, and they are Path West in Western Australia, SA Pathology in South Australia, and the MARTA Pathology in Queensland. Just important to note, requests that are sent to MARTA Pathology, so if they take their pathology there, it will automatically be uploaded to My Health record, unless of course they manually withheld. Now, there are some pathology providers with requirements, and what that means is they require the practice. So if your practice hasn't done this yet, they require them to activate the practice. So for example, if you refer to Sullivan Nicolaides or Sonic, you'll need to call them directly to enable that e-ordering or e-requesting functionality. And what that will mean then is that result for your patients will be uploaded to the patient's My Health record. Now, your practice also needs to be registered for a My Health record, and they also need to have a recent version of their software installed. Now, once the pathology request is generated as an electronic request, this is what it looks like. It doesn't really appear exactly the same way. It depends what it looks like. It might have a barcode up a different area somewhere, but it's no real difference other than it puts a barcode on, and you just have to select the e-ordering within your software. So what it actually does is the pathology electronic request automatically shares an electronic copy of the detail of the request with the lab that you're sending to. So it goes directly from your clinical software in parallel to this printed request you can see on the screen, that this is obviously given to the patient. And then what it does at the other end is it streamlines that process, as well as automatically sharing a copy of that report to the patient's My Health record when the results come in. Now, importantly, it's 7 days before a patient can see their results. So it does give you plenty of time to be able to get that patient back in should they need to come back into it for a review. And I guess it's also, if you're doing this, to have that conversation with your patients to say, we are uploading pathology to the My Health record now, but reassure that if you're concerned, please call the practice as per normal, and we will also contact you like within our normal processes that we've done previously. It's just that you'll have a copy in 7 days of your results. So sharing prescription information is electronic transfer of prescription, and it's secure exchange of prescription information between your prescribing systems and the dispensing system. So what it does mean is greater use of electronic prescribing processes. It really does help improve accuracy and safety of prescribing and dispensing. So when you generate the prescription, an encrypted electronic message of that script details is sent and stored in the prescription delivery service, or a PDS. Now, when the patient presents a paper prescription to the pharmacist, the barcode's scanned, and what that does is then it downloads the encrypted prescription detail from the prescription delivery service and is decrypted into the pharmacy dispensing system. So basically, then that pre-populates their information and it's just dispensed as normal. Now, not only does electronic transfer of prescription allow for prescribed medicines to go to My Health Record, it's also a mandatory requirement to participate in electronic transfer of prescriptions. Electronic prescriptions. So I will go through a little bit about electronic prescriptions next. Now, this is all very familiar to you all, I'm sure. So you can see on the right-hand side, this is the old paper prescription and the handwritten. You know, it was always hard to decipher. Then we moved to computer-generated prescriptions. So generally that was done via your clinical software, but it wasn't shared electronically. It certainly was easier to interpret, but it was definitely not shared electronically. So then I just spoke about the electronic transfer of prescriptions, so ETP. So a computer-generated prescription again, but then it contained the barcode and that enabled improves transcription of prescription information. So again, it helps with any errors when you're transcribing that information, especially from this paper handwritten prescription. In this instance, with the barcode, the paper prescription still needed to be provided to the dispenser, but electronic data still of the contents of this script are stored within the prescription delivery service until a pharmacy scans a barcode. Then the data pre-fills the dispensing system, as I said before, and then it's actually dispensed. So you can see in your telehealth consult so far, having the electronic transfer of prescription, I know they had the interim measure and so you were able to fax that off, but that would have been very supportive as well. But really, for your telehealth consults to have this N1, which is the electronic prescription token, and it contains a link to the prescription details, which is, again, encrypted and securely stored in the prescription delivery service. Now, the legal contents are the electronic detail that's stored in the prescription delivery service. So, you know, you can see sending this off in your telehealth consult will certainly help with the streamlining of prescribing medication. So let's look at that in a little bit more detail. So what you're able to do when you participate in electronic prescriptions is you can amend the prescription record just like you were before. Obviously, that's subject to your software's capability. You can cancel a prescription. You can deactivate the token that's issued. You can annotate an electronic prescription with relevant information. You know, sometimes you're going to put specific requirements, etc. You can reissue an electronic prescription token if the original was misplaced. And obviously, it's really important to confirm receipt of that token. But you can see here in your telehealth consults, which is really shown in this picture here, sending that electronic prescription really does support that telehealth consultation. All right, so the next screen is just to show you what it actually looks like. So here on the left-hand side, you can see it just comes through with a little note that says your prescription. And then over here, it says tap to view. And then these are both, there's only two providers in Australia. One's Medisecure and one is ERX. So you can see that these prescription delivery service providers they put the very limited data. So that's the name of the prescription, the date, the number of supplies, and just some other details within that token. But at all times, the prescription token is only just a key. So that's all stored electronically. Another way that you can do it is via email. Now we know, again, we talk very carefully about making sure things are encrypted. So, we know emails aren't that safe as such. So if you're looking here, they can actually get a prescription, electronic prescription sent via email. And again, that will still support you in your telehealth consultation, but you still don't need to be worried about it being intercepted and been stolen, because again, it does have still very limited details about the prescription details. So that evidence of prescription only, the information is still stored within the prescription delivery service. So it does still support that encrypted data. So while we're talking about email not being so secure, like faxes and those things that are often sent from practices, that brings me to secure messaging. And again, this is another a really reliable, secure way to send messages to provider. And really, it's a key component to be fully digitally enabled and integrated. And it really does help with that coordination of care across the Australian healthcare sector. So that's really important as well. Now, I've just said most of you already use My Health Record, or you send, even if you're using pathology e-requests, and you use even the electronic transfer of prescription or electronic prescribing, you're already using encrypted data quite seamlessly. And it does really support you throughout with that helping with digital technologies. And secure messaging is data that's actually encrypted on one side, and then it remains encrypted throughout each stage of the transmission process until, of course, it's decrypted by the recipient at the end of the communication. So secure messaging is really the next stage in your digital journey, I guess. So just a little bit about the flow, and you probably already realised this. So secure messaging, the information is managed securely in transit, and that prevents that interception. So like the other modes that we talked about before with the electronic prescriptions, that it was also preventing the inception by having limited information. And this really does improve the privacy of the patient information. Now, I wondered whether, John, would you be able to talk to us a little bit about the importance of secure messaging, and do you actually use that within your practices currently, and what's your feeling about sort of trying to move to a more secure form of sharing information between healthcare providers?
Yeah, look, Nicola, I think it's really important, and I think it's universally done poorly in the industry. There's a desperate need, I think, from a data breach point of view and data security point of view, for us to transition to more secure messaging. I think this particularly happens in rural practice between public hospital work and particularly after hours. In that context, we're getting better at it in the context of private general practice, and people are starting to look to secure messaging platforms. But to be honest, the uptake is poor. But our view, and certainly my view, is that it is important. And I think the risks around data breach and the potential fines and the legal breaches that could be happening here are important. One example is, a lot of doctors are still using their own personal mobile phones to take clinical photos and send them to colleagues. It's all very insecure. We risk data breaches from someone, having a look at your phone or picking up your phone. So I think there's a real need for real-time digital transfer of messages, and particularly clinical images. I don't think we're quite there yet, but it's certainly, there's a need in the industry, and I think it's really important that you're looking at this.
Yeah, that's great. Thank you so much for sharing that, and it really does highlight the importance. All right, so that I'll hand back to you now, John, to then go hand to Trent.
Yeah, awesome. Well, thanks again, Nicola. That was great. Your presentation was really clear, and it's I think it is really important that GPs start to engage with My Health Record more. It's a bit like chicken and egg. The more we use it, the more useful it becomes. And I think that's one of the barriers at the moment, is people are less likely to jump on it if there isn't the information that they need for their patient. But that's only going to get better the more we upload data, the more we make sure our discharge summaries are going through. And then it's going to snowball, I'm sure. And that secure messaging between providers, I think that's going to be really helpful. So thank you for that. I'd like now to introduce Trent Gifford. He's from the Medical Technology Association of Australia. I'm really excited to sort of to hear from Trent. Obviously, this is a fast-moving industry with changes all the time, and there's some exciting, I think, technologies and wearables and those types of things that could come into the industry that might be, really good adjuncts at helping us share information in real time, particularly with specialists, and getting real-time consultations and sharing images and that type of thing with our colleagues. So Trent, keen for you to take over and tell us a bit more about yourself and talk a bit about these innovations.
Yeah, absolutely. Thank you. quickly, thank you for having me. My day job, I work for a company called Tunstall Healthcare, where we've been involved in remote patient monitoring in the telehealth space for quite some time. One of the advantages of being in our position, being primarily a service company that sources third-party products, we have audiences, or we get the opportunity to sit in front of people with some amazing technology and what we have today and what's coming tomorrow. So that really excites us from a technology perspective. We see telehealth, and I'm sure this has probably been covered before, but we see telehealth as an excellent way, or technology within telehealth is an excellent way to help with, we're seeing it now already with task management, the collaboration that you'll see between specialists and multidisciplinary teams that are going between the different types of technology that's out there, and it creates that dynamic patient history that people can have access, all stakeholders can have access. And the integration piece is really important. So all the tools that physicians have used for a number of years is easily now able to be digitalized and Bluetooth with someone's mobile phone. In our business, and from a technology perspective, we talk about having to supply a device or a mobile phone to help connect technology, but we all know now that everybody's carrying their own devices. So we're starting to move into that space of bring your own or choose your own device, as opposed to bring your own. And how do we connect our sensors and peripherals with those particular devices? And probably one of the other things that's starting to become more prevalent and important from a diagnostic perspective is the AI. How does data help with that? How does it complement what I do? Like, I know from our perspective, when we have a look at the things that we're doing, not just us personally, but with the industry, and integrating that technology with remote patient care, like we know at the moment we can bring blood pressure monitors in, scales, oximeters and the like, and we can bring that into to get a reading. And there's obviously camera related diagnostic tools out there as well. But what's really starting to become more and more sort of focus for industry and development is these wearables, and what these wearables can do. They're a lot smaller. You sort of see the blood pressure monitors of yesteryear, but the things that people are starting to suggest that they are doing and can do, that I can put something the size of a 50-cent piece on somebody's shoulder, cover it with a Band-Aid, and it's going to act as an ECG, blood pressure monitor, temperature monitor. So from where we are now, there's a lot here to help us form opinions and diagnosis. But where we go tomorrow is quite exciting. I was lucky enough to go to the New South Wales Smart Sensing Network Forum a few weeks ago, and some very clever people in the room sort of talking to us about what is becoming more and more available, whereas yesterday it was an idea, and the smarter we get technology driving that, we're getting a lot more innovative. From an equipment perspective, from a data perspective, I think that's where it's starting to also become a lot more interesting, especially for us. As Tunstall, for example, we have over 5.5 million end users of our equipment across, not just those medical alarms, but remote patient monitoring devices across the world. So all that data, so we're starting to become a lot more, or the ability to start becoming a lot more predictive. We start to look at all that data coming in from different sensors, and what does it mean? We work with a startup out of Melbourne that measures people's appliance electricity usage in their homes. So what could I do with that information as a physician? It's not just the wearable that I'm wearing monitoring my heart rate, but what does that mean when I can also see that I haven't turned the kettle on, or I haven't opened the fridge? So trying to use all sorts of all sources of information to help form diagnosis is also quite exciting. But as I said, it's only just yesterday talking to a guy that's doing some work locally, but also overseas within the COVID realms, but developing something for dementia patients or the elderly, where they're particularly dementia, where they can't rip something off, they can't tear. It's something small, it's something discrete, and something that can be placed on the body, but give those vitals and give those, send those metrics through to the physician. So it's a very short period of time to talk about so many things that I could talk about. I've got slide decks left, right, and centre, but I'm sure I'll drive people crazy. But it's an exciting time. I think that the amount of investment, and I think also too, when you have a look at the technology and you have a look at some investment that's coming out of the Aged Care Royal Commission. So there's going to be a lot more people sort of looking for innovation grants to build and develop products and systems that are actually going to help physicians, clinicians across Australia and the world to better manage or to help manage. And I think what we come up against sometimes is, from a technology perspective, no way is it there to replace. It's there to aid, to help, and to sort of do what you can't for 24 hours a day, 7 days a week. And when you wake up and there's a report that sort of tells you what, you become more informed. But there's certainly, yeah, I could go through a lot.
Just coming off mute, Trent, thank you so much. That was interesting, and it is exciting to see the Internet of Things extend into healthcare, real-time monitoring. I'm excited to look to the future, having telemetry for my patients, linked to active recalls, where you might call a patient in if they hit a threshold with a certain measurement of blood pressure or heart rate, or flag them to come in if they're having irregular heart rates. I mean, I think the potential for prevention and early intervention and reducing hospitalizations and really ramping up the benefit of primary care is huge. The other area that I've seen, which I think is really exciting, is wearables for clinicians. So I've seen a prototype in a state health facility of like a Google glasses that a doctor would wear, like a remote doctor might wear, and you could have a surgeon in the city seeing exactly what you see and guiding your hands. I mean, that sort of stuff is just Star Trek.
And it certainly is. And, you look at the virtual reality technology where you can actually have someone that could be 500 kilometers away, 1,000 kilometers away. Helen, who spoke earlier, sort of from Perth to Kalgoorlie or somewhere like that, where you're actually picking the patient up and turning them around to see what, to help inform your opinion. It's limitless. And I think what we've seen in the last 5 years will be nothing in comparison to what we're going to see over the next 2 to 3 years. But that data piece is going to play an important piece as to pulling in from so many different sources. It can only be helpful. I think it's a good time, and I know I look a lot older, but it's a good time to be in my mid-40s, because by the time I sort of get older and potentially need more care, there's going to be a lot more to keep me around for a little bit longer, I'm sure.
Oh, absolutely. Look, it's definitely an exciting time to be involved in the industry, and you mentioned AI practices I'm working with at the moment. We're looking at doing a trial of AI dermoscopy with a mob out from the UK, where we'll have computer diagnostics for images and that type of thing as well. So all very exciting. Any decision aids and decision support we can get, the better.
Yeah, and
I think we're going to have some questions now, and Brianna, you were going to jump in here and sort of lead some questions around digital issues and that type of thing. And and if you had, I hope I didn't cut you off there, Trent. If you had anything further to add, we've got a bit more time if you needed.
Yeah, no, it was just a comment, and I think it might be raised in the discussion just around connectivity, and as that does improve, the capability improves, and I think the adoption will improve more. There'll be more trust in what it can provide, and as you said, that real-time, timely sort of presentation of data to make your decisions. It's going to be even more critical. So 5G is an exciting part of that puzzle as well.
Awesome.
Thanks so much, Trent. Thanks, John. So I will take this opportunity as well to ask anybody on the line if there are any questions, to use the question and answer box in your Zoom platform to send any questions through. So we've heard about, My Health Record, secure messaging, electronic prescriptions, and some of these really interesting and exciting technologies that are now coming into the industry. So, you mentioned at the end there, Trent, about connectivity. I guess this would be good to throw to both Helen and then maybe John, if you've got anything to add. But Helen, in your experience in practice, is connectivity still an issue? And what's your experience around that?
Well, having personally experienced the hookup with NBN, where they cut off our phones for 3 weeks and we had to revert to mobiles. Look, certainly, I mean, we're city-based, but we do service FIFO workers. We've got a couple of guys in Barrow Island that quite often ring us. Look, it can be an issue, but mostly we're pretty good. There's sometimes a bit of a delay, but then we can always revert to phone calls. We don't do lots of video stuff. WA's been fairly lucky that we haven't had to shut down significantly, so we still have been able to do a lot of face-to-face, but we're a healthcare homes pilot program practice, so we have utilised that to service some of our country patients. So we were already doing a bit of telehealth and video health before COVID hit, but connectivity, I know, is an issue for some regional areas, and certainly some of the more remote communities do have issues. But I guess that's a work in progress, like all of these technologies. My health records, everyone's just, slowly getting on board with things.
Thanks, Helen. And John, do you have anything sort of to add there?
Yeah, look, I think connectivity is a really important issue. And like Helen said, we've certainly got a number of anecdotes across the industry, particularly in remote, where it's a challenge. One of the things I'd like to say about connectivity, though, and I've heard a bit of negativity in meetings from sort of rural and remote representatives around this, where I'd hate to see it as a disempowerment, as a distractor or something that I guess prevents the implementation of telehealth and technologies into rural. I think sometimes this is lent on as, it's not going to work here, our connectivity is not good enough. I don't think we should accept that. And I'd go further to say that in most of the rural and remote sites I've worked in, there's been good enough internet to do things. Like I'm in Walgett at the moment, remote northwestern New South Wales, and I've got great connection. So I think I'd hate to see that narrative discourage its use. And I've certainly heard it discussed in meetings with government where people have said, we don't have the connectivity out here. And if that led to, it not being implemented or not being more broadly used, I think it's a massive lost opportunity that the people I see that will benefit the most from telehealth and particularly video-based technology are our remote patients. So I think we don't accept it, and where there are black spots, we lobby hard, and we know we've got the technology to have good connectivity, and it's about bringing our governments to account to make sure that they invest in the infrastructure that allows for it. I know many of the state-based hospitals have had a legacy of very good connectivity because they've put in place the connectivity that was needed for remote telehealth in the acute setting, which has been around for many years, as many of you know, like into emergency departments. So if it's possible to do it in acute settings, it's got to be technically possible to do it in primary care and in the community. So I think we need not to accept connectivity issues, and we certainly shouldn't be it shouldn't be a barrier to implementing these technologies into rural and remote, where we know we've got the worst health outcomes and the most disadvantaged.
Yeah, thanks for that, John. Some really, really valid and interesting points there. So I guess the next sort of question that comes up is in regards to utilizing these different technologies in conjunction with our telehealth consultations. And so maybe Helen, if you want to provide some insight or share what your take-home message would be for providers on the line around using, My Health Record in conjunction with telehealth or electronic prescribing in conjunction with telehealth, and how have you seen that work? And do you have any experiences with workflows and how you've implemented those in practice?
Yeah, look, I think, making sure that you do all the checks, with the patient, that you've done your 3 identifiers and you've sought their permission, which I think is really important. You can actually get quite a bit of information. And, in my role as the nurse, quite often, if I've got somebody on the phone wanting to connect with the doctor, I can say, ask, those questions and say, may I have a look at your electronic health record to get some information to make the consultations more smooth with the doctor. I can see that, yep, there's a discharge summary there. Yep, I can see what's going on. I can better inform the GP, and likewise they can open it up while they're having the consultation, with the patient. And it's those conversations about, I see that you were prescribed this medication, how's that going? Are you able to take it as it's been prescribed? And quite often they go, oh no, well, it didn't agree with me. And like, it just gives more flow to your consultation by actually having access to that. And you can also go back and look at old pathology from a few weeks ago that may have been done somewhere else, like they've been on holidays, or so you can say, yep, we can see that, we can see what happened. And I think it just gives you more tools to get to the bottom of the patient's concerns and ask those relevant questions.
Thanks, Helen. And John, if you've got any experience to share around integrating sort of, My Health Record, secure messaging, electronic prescribing, and how you see that working in your workflow, and, your sort of change management around that, how did you sort of start introducing that into your workflows?
Yeah, look, I mean, it's been, telehealth in the context of COVID has been transformative. It's been an essential component to the effective management of the pandemic in terms of patient flow and protecting patients and protecting healthcare workers. So it's, it's certainly been welcome. And I think, I certainly commend the Australian government for its rapid pivoting to telehealth at the beginning of COVID. I think it's accelerated our digital transformation. But what we learned very quickly, as you've touched on, is that it's not just connecting with a phone, it's not just connecting with a video. There's so many steps in the process, from booking to linking in booking software into appointment book software, through that integrating into our electronic health record in general practice, then to the digital transfer of referrals and scripts and pathology requests, which none of us had that ready to go. So we had to quickly look at and brainstorm different solutions. In the company that I work in, I'm the Director of Medical Services for a large GP organisation, and we had meetings with our lead doctors across all of our sites, and we're brainstorming how we're going to do this, and we were sharing information in real time about different solutions that different GPs were using, and it was actually quite an engaging process, and we were all learning from each other and learning on the run. But we were all quite nervous about just using old technology like email. I mean, it's in the old accreditation standards that we shouldn't use unencrypted email, but at the start of COVID, we didn't really have a lot of other solutions for digital transfer, and as I said, this digital transformation has been accelerated, and it's so exciting to see the advent of digital prescribing, which I don't think would have happened for probably another 5 years if COVID hadn't happened, and look at the delays that happened even within the context of COVID. So certainly welcome and exciting. My only comment, I guess, to finish off on this topic is I think there's a real risk we could lose this opportunity if we don't embrace the digital transformation and carry it through post-COVID. I think there's a real risk that we could miss an opportunity for genuine digital transformation and actually holding on to some of these technologies. If sort of COVID dissipates too quickly and people sort of pull back to sort of old school business as usual, I think there's a risk, and we're already seeing that in sort of a lack of appetite in the industry to take on video-based telehealth. I still think there's a fairly low uptake when it comes to e-prescriptions and digital requests for pathology. And what I think, it'd be great to see this COVID opportunity to really double down and establish that as the norm, because of I think the protections for the patients in terms of closing the information loop, in terms of their own digital data security. There are so many benefits for the patient in this. This is, for me, it's more about the patients and their outcomes than what's good for doctors and what's easier for them in their workflow and what's better for the bottom line. We should be actually putting the patient at the center of this. And what's really clear is these technologies are really good for our patients, and they're going to be really good for our patient outcomes. So I think it's really important that the industry embraces it. So I think more of this and more of the education and more of sharing is what's needed to try to get our industry to heave towards and to take on permanently digital transformation in the ways that we've discussed.
Thanks so much, John. That's fantastic. So I think we probably have time for one more question before we close. And so this one might be good for you, Nikki, just around, with the focus on all of these digital tools that are now being integrated into our practices. How can we ensure the cybersecurity of the data that we have for our patients? So can we maybe direct people to where that they can get a bit more information about being cyber safe and putting the right policies and procedures in place for all of these digital tools?
Yes, certainly, Bree. And we're talking about connectivity, and I do apologise. I've had to turn my camera off. I've had terrible connectivity issues tonight. So yes, it's definitely an ongoing problem. Look, we do offer a range of cybersecurity guidance materials that will assist your organisation to keep digital health information secure, and also in addition to selecting secure online conferencing technology and to conduct your telehealth consultations. Now, all these technologies, of course, need to be maintained, and that means also including keeping the platform and all other applications and operating systems used by your businesses up to date. So it's really good to keep that in mind when you're selecting or changing platforms. Now, we have a number of guidance materials that I'm happy to share. We've got like a bit of a slide that I can grab and send through to Peter so she can share that with you all. And they give you practical advice on information on security topics. There's a variety of formats, and it's some digital guides, I think. There's some templates. I think there's podcasts, and there's also some fact sheets. So we're happy to share that with you. I'll send that through to Peter. Hopefully I didn't freeze through that.
No, that came through all good. Thanks, Nikki. Handing back to you now, John.
Well, thanks so much, Brianna, and thanks, Nicola, for that. That's really helpful. Look, I think this is just about a wrap. I'd like to thank you all for joining us tonight. If you'd like some more information, we're going to be sending email lists out to all of you. We're going to also include in that useful websites and an evaluation survey. Just so that you know, a recording of this webinar will be made available tomorrow. So thank you all again for joining us, for your participation. Thank you again to all of the panelists for giving up your time, and have a great evening, and we will see you next time.
Thank you. Thanks for having us.
Thanks, everyone.
Thank you.
Bye-bye.
Bye.